Hi, my name is Colin Mahoney. I'm an assistant professor in the Department of Psychology. I'm also a clinical research psychologist. First, I just want to commend all of you for making it through such a difficult year. I know for many of you, you probably feel depressed, anxious, scared, overwhelmed, burnt out. Those are all normal feelings to a really difficult year. Particularly, I like to describe it as a normal reaction to an abnormal situation. Whereas Dr. Carpenter talked to you about different types of stress, I'm going to talk to you specifically about traumatic stress, as that's my area of expertise. So, traumatic stress is something that arises when someone experiences a traumatic event. Now, a traumatic event is any actual or threatened death, serious injury, or sexual violence. In the case of COVID, this would look like if you yourself were symptomatic for COVID, or if you were hospitalized for COVID. Both of those situations, you would have a sense of threatened death or serious injury. So, besides direct experience, another way that you can experience a traumatic event is about learning about it happening to a close friend or family member. In those situations, it would be like if a member of your family or a close friend was symptomatic for COVID, was hospitalized for COVID, or unfortunately, if they died of COVID. All of those situations, whether it happened to you or somebody else that you care deeply about, would be considered a traumatic event. Now, following that exposure experience, people can experience a variety of psychological effects. These include depression, which would be depressed mood, loss of interest in things that you used to like to do, changes in your appetite, either increases or decreases, changes in your sleep, where you're either sleeping too much or sleeping too little, problems with concentrating, feeling excessively guilty or worthless, or even recurrent thoughts of suicide or death. Another psychological effect can be anxiety symptoms, which can present as muscle fatigue or chronic kind of worry about something happening to you or someone you care about. And anxiety can get to the point where someone might experience a panic attack, which is an intense surge of anxiety that usually peaks within about 10 minutes and then dissipates from there. That typically has physical symptoms such as increased heart rate, difficulty breathing, sweating, or trembling as well. Lastly, from a traumatic event, someone can experience what's called post-traumatic stress or post-traumatic stress disorder. You can experience symptoms of PTSD without actually having the full diagnosis. So that would be things like intrusive memories, thoughts, or feelings about when you had COVID or someone you knew had COVID. It could be avoiding thoughts or memories or feelings about it, or avoiding people you know that have had it, like including not wanting to talk to them or not responding to phone calls or text messages or things like that. It can also be changes in beliefs, so changes that the world is dangerous, that other people can't be trusted, or that something's wrong with you because you had symptoms of COVID at one point. This can also end up with an inability to experience positive emotions like joy and happiness, and kind of persistent negative emotions, so things like depression, anger, fear, horror, and guilt. And then there's also another set of symptoms that comes up within PTSD, which are called hyperarousal symptoms, where you feel kind of on edge, concerned that you might get COVID again, and concerned that someone you know may get COVID. And you might even engage in some reckless or self-destructive behaviors like substance use or driving recklessly, or engaging in other things that might cause you some sense of harm. Now, I've talked to you about traumatic events and the stress that's associated with that. I've talked to you about some of the psychological effects of that stress, including depression, anxiety, panic attacks, and PTSD. You can experience symptoms of these, again, without actually having the diagnosis. Lastly, I want to talk to you about ways that you can cope or deal with all of this stress. So when someone experiences anxiety, one thing that often happens is it activates a part of your nervous system called the sympathetic nervous system or your fight or flight system. And what that does is puts you really on edge. Your heart rate increases, your breathing increases, you feel really anxious and worried. And what that does is it makes it really difficult to deal with things like school and work and other relationships. So a way of slowing that down and activating another part of your nervous system, which is the parasympathetic or your rest and digest system, the way to relax your body and relax that anxiety is through something we call diaphragmatic breathing or belly breathing. So I'm going to show you a quick demonstration on how to do this. So essentially, when someone's anxious, they breathe only through their chest. What we're going to do is teach you how to breathe through your stomach. And the way to do that is you put one hand up here on your chest, one hand down here on your belly. And what you're going to do is you can take a long, slow breath in through your nose. And as you're doing it, you're going to try to fill your stomach like it's a balloon, just slow and easy. So slow, deep breath in through your nose. You're going to hold it for a second or two, and then you're going to breathe out slowly through your mouth. So you should feel this hand move a lot, and this hand shouldn't move much at all. So again, you can do a deep, slow breath in through your nose. Hold it for a few seconds, and then a slow, deep breath out through your mouth. Once you get a rhythm of that, you want to do it for about 3 to 5 minutes to get the full effects, particularly when you're feeling really anxious. It's best to practice at a time when you don't feel anxious, though, so you can use it when you do. So in the morning when you get up or at night when you go to sleep are good times to practice it. The next thing I'm going to talk to you about is what's called grounding. So grounding is a way of anchoring you in the present moment. Anxiety tends to be very future focused, and depression tends to be very past focused. But if we're in the present moment, we're less likely to be anxious and less likely to be depressed. So the way grounding works is first focusing on your breath, focusing if your breath is in your lungs, it's in your nose, if it's in your mouth, where your breath is, right? And then what you do from there is what we call 5, 4, 3, 2, 1. So you look for 5 things that you can see. This could be your desk, this could be a pen, this could be a book, this could be somebody you see on campus or a building. You just name 5 things you can see around you in that moment in your head. Then 4 things you can touch. So that could be your leg, that could be, again, a pencil, a desk, a book, something that you're eating, anything that you can touch that's right around you. And then 3 things that you can hear. So this could be birds chirping, it could be music that you're listening to, people talking. And then 2 things that you can smell. So this could be anything around you. It could be food, it could be aroma in the air, it could be a candle or lotion. And then lastly, 1 thing that you can taste. So you can pay attention to your mouth. Do you taste coffee that you drank that morning, or a sandwich that you ate, or gum that you chewed, right? Doing this 5, 4, 3, 2, 1 is a great way of anchoring you in the present moment to help you to feel less anxious and less depressed. Lastly, I'm going to talk to you about behavioral activation. This is a way of engaging yourself when you feel depressed. So the main thing is conducting or engaging activities that are going to improve your mood. So doing things that make you feel good, or make you feel accomplished or proud or productive. Those types of things are going to make you feel much better in moments that you feel depressed. So things like taking a walk, going for a hike, exercising, connecting to a friend or family member, reading a book, anything that's going to feel kind of like a healthy activity to you, right? The thing I'm going to leave you with today, though, is the most positive predictor of mental health and well-being is social support. So although you're restricted right now from a lot of your friends and family members, what I really encourage you to do is call them, text them, FaceTime with them, do whatever you can to connect while maintaining social distancing in a way that's going to be really helpful and beneficial for making you feel connected and making you feel less anxious, less depressed. Please reach out to me if you have any mental health questions. My email is colin.mahoney@wne.edu. If you really feel like you're struggling with depression, anxiety, post-traumatic distress, any other psychological effects of this pandemic, I highly encourage you to reach out to the Western New England University Counseling Center in the Campus Center, room 249. Thank you. Have a great day. Take care.